All right. Today, 12 o'clock on Tuesday, a little bit better luck with technology today, so we're thrilled about that already. Um, Good afternoon, everybody. It's a kind of a gloomy Tuesday out there. I know it continues to be a tough road to hoe with all this stay at home, but it is now more important than ever that we continue to do what we're doing. We saw the Department of Health released some data yesterday by zip code, and it makes sense that Scranton would have the most cases in Lackawanna County. We have a third of the population. We have more than half of the nursing home and personal care home beds here in Scranton. We know nursing homes, unfortunately, have being hit particularly hard around the country. It's hard to even say. I believe the tally is over 7,000 deaths across the country in those homes. But it's really tough to look at that data and see the number of cases, in your zip code. It brings it home in a way that, with data information didn't have access to until yesterday. So, please take that as a reminder that this is why we're doing this. This is why we're having to go through all these hardships, is that cases are real. This illness, the virus is real. The deaths from it, that potential for people to succumb to this virus and the disease, it's real, and we have to keep doing what we're doing. I know there's a lot of press out there and protests and things about people saying, I'm sick of this, I'm not going to do this anymore. Well, if we take the brakes off now, I mean, if we pump the brakes and stop what we're doing, we're going to open ourselves up to a spike in cases, a spike in deaths, and everything that we've been doing is going to really be for naught. So please continue to use those social distancing the techniques, I guess, that we've come up with. Wear those masks. Now, because of the governor's order that started on Sunday night, you're strongly urged to wear a mask when you leave the home. So if you're going to go out and go to the grocery store, if you need to go out and get a prescription, you've got to wear a mask. Please do that. You can make one from home. Like I said, you can always call us at 348-4101. We can get you a mask if you need one. It might not be a perfect mask, but we can certainly try to help procure one for you. It's really important that we continue to do these things, and that's why I'm honored today to have Dr. Shrikant Hosier from the Geisinger CMC with us on the call today, so he can reinforce for us why all of this is so important and give us a bit of an update about how the efforts that we've done so far have been working. Dr. Hosier?
Oh, fantastic. Social distancing is part of it. I have, and I work with it actually in a game, which we call it a doubling time. Essentially, what it is if this virus spread, and it is very highly infected, one individual on average can infect, without social distancing, about 453 individuals. But if you practice 100% social distancing, and what I mean by that is 6 feet apart, wearing a mask, not coughing in public places, washing your hands, not touching your face, staying home as much as possible, unless it's for very important errands, and at the same time, be very open to the fact that you can spread this disease and stay and be very aware of it. You can prevent one individual then will infect only 2.5 folks. So I really think today, because of the social distancing measures, we are where we are. I mean, you can see that in the national trends that things are settling down, the doubling rates are coming down. New York seems to have plateaued, and so are other places, including our state. Things have plateaued. But remember, this is a marathon. This is not a sprint by any means. We cannot take comfort in basically saying, hey, we already won, and be complacent about it. We have to continue to practice these measures to the extent we can, and follow the advice of our leaders, especially the healthcare leaders, both at the federal level and state level, and continue to enforce social distancing as appropriate, because that's the way to combat this disease. Does that answer your question, Paige?
Yeah, if you could repeat that the information about what it means if we don't have social distancing measures in place, what that infection rate could look like. Am I right that if we don't have any social distancing measures, one person with the disease could end up infecting 453 people? Is that the model?
That's sort of the model. That's average. About one individual can infect about 400 odd individuals, and those 400 odd individuals can in turn infect 400 other individuals, each individual. So that is a humongous number, and we have to be careful. But fortunately, that has not happened. That means social distancing is working.
Right. That's why we have to continue to do it, though, right? Because if we take these measures off and we just kind of open everything back up, all of a sudden, we're going to invite the virus to proliferate.
You're right, and the way we have to do it is in a very scientific manner. Based on what our public healthcare officials and our data shows, and do it very cautiously and appropriately. And I think that's why we have to continue to listen to what our experts say and what our experts suggest.
Right. Well, you are one of those experts, and I'm so thankful that you've been able to continue to not only keep us informed here at the city, but to be there for us for Scranton, up at Geisinger. Is there anything else that the city needs to know in terms of access to care, access to testing, any advice for us or any news?
If you have symptoms, call the Geisinger hotline. We are still doing testing for those individuals that are meeting the CDC screening criteria. We are definitely testing all our employees. We are testing everyone who actually has symptoms who's admitted to our facilities. And we have our own testing, as you know, that we have a rapid turnaround time. But at the same time, we have to be cautious about how much testing we can do.
Right.
But if you have symptoms, practice social distancing, call the Geisinger hotline, and stay home.
Right. And we got to continue. People shouldn't be going from state to state without absolutely having to. We shouldn't just be traveling for fun. I mean, all of these measures need to stay in place for the near term, right?
That's my opinion.
Yeah. Right. Yeah. And so with testing, I know we as a country, I think, have been frustrated that we haven't had more access to testing. It sounds like there might be an increase on the horizon somewhere, but for the time being, what we have is what we've had, which is you only can get tested if you exhibit symptoms and you call the number called either Geisinger or the 888 PA Health, and then that way you can make an appointment to get a test, and we go from there. I know we're hoping for the day when that opens up and we have much more testing in our area and in Pennsylvania, but for right now, that's the deal, and we continue to advocate for more tests. Dr. Hosier, before I let you go, I did want to talk about testing and just get from you, one of the experts, of how testing would help us. Why is it so important that we get tests and that we increase contact tracing? To me, I don't see how we open up our society and the economy again without a vast increase in the resources of tracing and testing.
So actually, testing actually helps in a couple of ways. Number one, it improves you to actually stay home and actually not spread the disease. So and plus maybe help those asymptomatic carriers stay home. And two is we could actually follow these individuals and make sure that they're following social distancing, and that will help basically stem the infectivity.
Right.
We do have same-day access at this point of time for the testing for the public. If you that is the latest I hear. If you could call the Geisinger hotline, it might be a little more easier to get that test done today. Okay. But you have to meet the criteria then. Right.
But we have to get to a point, I think, or the best case scenario is we get to a point where you think you might have been infected and you can get a test. or you can just get a test to go back to work, or just to feel more comfortable. But we're a ways away from that level, that volume of testing being available throughout. I mean, really throughout the country.
That's that's a correct
Right,
statement.
right. Okay, well, we'll continue to advocate for testing and tracing, but we, from our level and what we can do at the city. But I know you guys at Geisinger, we're so lucky to have you taking care of our city, taking care of all of our neighbors, and we appreciate all the hard work that you guys have put in. I know you've been working absolutely around the clock, and without you, I'm not sure where we'd be. So we appreciate you, Dr. Hosier, and your whole team there at Geisinger.
No worries. Thank you very much, Faisal. We are prepared, as you know, as it doesn't have a big seed system. We are ready for any surge, and we have a lot of leverage in the sense there are two things we know are absolutely true. That there will be a surge, and if there is a surge, we hope there is not. If there is a surge, we are prepared. But whatever be the timing of the surge, we have the advantage that the surge is going to have a lag between here and our other campuses, and we can leverage basically those strengths to our advantage. So we are prepared, and we are here for the community, and we will see this community through.
Yeah, thank you. When we think about, people ask me how it's been to go through this, and I have to say, it would be a real struggle if I was, managing a city government that didn't have hospital systems like we have with Geisinger and Regional Moses Taylor. Having your institutions in our city, right in the Hill section, right up the street, really from City Hall. It's made this, from the moment we realized how much of a crisis this would be. It's made it manageable because you guys are there. So thank you very much, Doctor.
No worries. Thank you, Mayor.
Thanks. Yeah, so there it is. Dr. Hosier says it better than I ever could about why it's necessary to do all of these things and keep at it. We just got the new data in. The positive cases in Lackawanna County are 666. That's not a good number. So let's look forward to, well, I hope that number doesn't go up. Maybe we can end there, but that's an odd one. Maybe a little bit of levity in a dark time. And our deaths are at 53. So we are still on the high side for the per capita death rate in the state. I saw a question, I think from Judy, about the nursing homes. We've been in direct touch with all of the nursing homes at the city level, and then I've been in touch with the director at the Department of Health that runs nursing homes. We are trying to understand what information we can and get that out to the public. I know that the Department of Health is working on getting more information out. I've really asked them to be more communicative, and I think they're working on it, but we do need more information out there. The public deserves more information, and we've raised that with them. So as soon as we get more information in terms of cases at the nursing homes, we will get that out into the community. So it's a really tough situation. I know that the nursing homes are working hard to contain the virus if it's there, or make sure that it doesn't come in. It's really, I know it's been a struggle at every side of the elder care spectrum throughout the country, and unfortunately our homes here in Scranton are no exception. So we're working on getting more information. I know the county coroner, Tim Rowland, has also been really pushing for information. So hopefully our efforts will get some traction, and we'll be able to get more information out to you as soon as we possibly can. Let's see. Sorry, I know somebody thinks I say too much. I'm looking at a lot of different devices trying to track my thoughts and read things, and also also communicate with you and read the comments. So I'm working on it. All right. On the nursing homes front, so we've asked for more data. We've asked for more communication. We also did formally request an investigation into the deaths at the Jewish home and other deaths in the nursing homes in our area. It's really, really devastating what's been happening there, and we have officially asked for an investigation. I wanted to touch on the prison and courts. There was a question on Friday about that. I believe as of yesterday, Judge Michael Barrace issued an emergency order extending the judicial emergency to May 31st. The order was set to expire on the 30th. So that judicial emergency is extended to May 31. The Lackawanna County Prison has had one confirmed case of a staff member. That individual has fully recovered and remains in quarantine. Those are those two pieces. The other is that the federal and state courts are reviewing each detainee's case on a case-by-case basis, with COVID-19 issue being a factor. Other examples: seriousness of offense, past criminal record, ties to the community, obviously the flight risk and those types of things. So they are looking at that to determine when release is appropriate. And if we get more updates on that front, we will let you know. And we are fortunate that the Lackawanna County Prison hasn't seen an outbreak as we've seen in other places in the nation. I just extended our emergency declaration last week through April 30th, and Governor Wolf extended the statewide to May 8th yesterday. So I anticipate we will continue to follow the governor's lead on that at this point. We'll give it a few days, maybe a week, before we extend it to see if it needs to be extended further. But we are at least extended through April 30th technically, and I imagine at least through May 8th following the governor's order. The Keystone mission, let me back up. Just wanted to reiterate that the masks are now mandatory when going out for essential tasks, so you've got to wear those masks. Please do it. I know we all look ridiculous. Just kind of try to have fun with it. That's another governor's order. So an update for you: the Keystone Mission is partnering with us at the Weston Fieldhouse. We now have an emergency shelter there. They still have space, so for those of you out there, if there's anyone out there on the phone or on Facebook, or if you know someone, especially if you know somebody that could use a shelter during this time, the Keystone Mission at Weston has beds and availability of services. They're doing case management services with the shelter. Obviously, they're providing food and supplies to be able to shower and clean up. So please, you can email us or call us if you want to get passed along that way. It's 348-4101 for us, or Scranton 311 at scrantonpa.gov. I know we've already seen some really cool stories coming out of there where people are getting in touch rapidly with some services that can help them get back on their feet. So we're very excited to partner with Keystone Mission on that. And please do think through everyone you know, or someone that you don't even know that well, but might want to let them know that we want to get that word out. The Colts bus has a recommendation. They are strongly recommending all passengers wear masks or face coverings. I know they've been getting some complaints about why they're not mandating it. Colts reached out to me this morning to make sure that I was able to let you know that the state did not include public transportation in its order to wear masks. Dr. Levine, the Secretary of Health, specifically said masks are strongly recommended for riders of public transit, but not specifically required. Colts is following that recommendation and strongly urging and recommending that riders do wear masks for everyone's protection. So I appreciate Gretchen Wintermantle at Colts. Thanks for working with us on that. I'm sure I'll just say on the city end, and just for me, please wear a mask. We have seen, you've seen cases, especially in New York, where transit drivers have died of COVID after being in close quarters with many different passengers. So please do wear a mask if you're going to take Colt's great services. It's really the least you can do. So please do your part. There's a good update on the unemployment front. The Pennsylvania Unemployment Assistance is up online. It's providing 39 weeks of unemployment benefits to individuals not eligible for regular unemployment benefits. So independent contractors, gig economy workers. So finally, there is a program for you. The application is available at uc.pa.gov. You'll need, of course, your documentation, and you can submit these claims backdated to January 27th if you've been unemployed due to COVID-19 reasons. So that's great news. Again, uc.pa.gov, new program for gig economy, independent contractor workers. That's great news, and I hope that we're able to get through. And yeah, we're still working on figuring out how, if there's a way to get in further along in the unemployment process for all of you out there. The U.S. Chamber of Commerce just set up a Save Small Business Grant Fund. That's something that we're also working on here in Scranton to do a local one. But there is so Save Small Business. It's savesmallbusiness.com. So savesmallbusiness.com. That's a national grant fund, and watch for some local help too. We're going to have to attack this from all sides, and we continue to try to work with our local Chamber of Commerce and our other economic development partners and local banks to get more immediate relief for our small businesses here. Okay, and the food piece continues to be something that we are really, really concerned about here at the city. So as we keep saying, dial 211 if you need help with food assistance, utilities assistance, rent assistance. But in terms of the food itself and access to food, Friends of the Poor is doing an emergency drive-through tomorrow, Wednesday, April 22nd, from 2:30 to 4:30. It's in Troop at the Mid-Valley Secondary Center. That's at 52 Underwood Road in Troop. So again, tomorrow, Wednesday, 2:30 to 4:30, Mid-Valley Secondary Center, 52 Underwood Road in Troop. The pantry is still online 9 to 12, Monday through Friday at Jackson Terrace and Valley View Terrace here in Scranton. Keystone Mission, Monday, Wednesday, Friday, 1 to 4 at 8 West Olive Street. The Salvation Army Daily Food Box, you can call 344-9878 to schedule an appointment for pickup. There's drive-through pickup Tuesdays through Fridays at Salvation Army. That's 500 South Washington Ave. And seniors or other vulnerable individuals can make arrangements to get the food delivered to your door. The Scranton and Dunmore Fraternal Order of the Police, Lodge 2, and the Scranton Police Department are hosting a free pasta dinner this Sunday from 1 to 5 p.m. The dinner is drive-through only. It's at 401 Railroad Avenue in Scranton. Please enter on the Railroad Avenue side of the building and limit 4 dinners per vehicle. But thank you so much to our Scranton Police Department, to the Dunmore Police Department for setting up this spaghetti dinner. It's going to be really cool. It's on Sunday, 1 to 5 at 400 Railroad Avenue here in Scranton. So that's some good news there. On the SNAP benefits issue, we have formally, I wrote a letter to our senators and to the White House to get SNAP benefits online. It's very difficult right now, obviously, if you have SNAP but you're not able to leave your house very often or at all, that you need to be able to order those groceries online. So I know Senator Casey's working hard on this as well. So we've been lobbying for that and hope that program changes very soon. I do want to say that there are emergency SNAP benefits being issued. That supplemental increase for both March and April will continue through April 29th. So that's on the SNAP side. And again, really hoping for some common sense reform of the SNAP program right now, as we have already a month ago moved to online shopping and remote food shopping and food sources. The last piece on food is we finally got our approval that we can help fundraise for some of our nonprofits. So I'm excited to announce that we're partnering with the Scranton Area Foundation to put together the Heart of Scranton virtual fundraiser for feeding our city. That's going to be on Thursday, April 30th at 7 p.m. It'll be on YouTube and on ECTV. We're going to be raising funds for the Northeast Regional Food Bank, for Meals on Wheels, and for Friends of the Poor. All the funds, the donations will go directly to those entities so that they get the cash they need to be able to buy the bulk food, that wholesale priced food, to get it out and distributed to our families in need in Scranton. So thank you to the Scranton Area Foundation for that. We're really excited to put that together. We'll be advertising that with, of course, the donation links on our Facebook, on our website, and we're very appreciative to all of you who can give something, even if it's just $1, just a couple dollars. Even that helps. Right now, the food bank, for example, isn't able, they don't have the bandwidth to take individual food donations, actual food. So if you think, I usually would donate, a bag of canned goods or something, well, instead of that, you can't even do that right now, given their staffing limits and their social distancing protocols. But you could drop, $5, $10, whatever it is you can give. You can do that right now. Or you can also do it for the fundraiser. So thank you to everybody who will participate in that, and I think it's going to be a good initiative. So speaking of what you can do, volunteer opportunities, like we've been saying, check in with your neighbors. Helping the Homebound program, we're excited that that's been going really well. I was at City Hall this weekend. All of the green and yellow flyers for people were gone, which was cool. They're back in there, don't worry. I believe they resupplied them, but I think it's going well. So helping the Homebound connects homebound seniors with volunteers to check on them. You can volunteer by emailing volunteer@uwlc.net. If you want more details, you can call the County Area Agency on Aging at 963-6740 or aaa@lackawannacounty.org. So those green and yellow papers, again, you can pick them up at the back entrance of City Hall, and we are excited about that program. So we continue to put lots of different volunteer opportunities on our Facebook and our website. Something that you can do, of course, as always, is donate blood. 1-800-RED Cross, to just call Red Cross to donate blood. You can volunteer to pack boxes for the food bank. Keystone Mission needs volunteers. Meals on Wheels, United Neighborhood Centers, all of that is really important, and I know there's so many that you out there that want to help. So we can kick it over to questions. I just see one question in the hopper from the last couple days. Michelle asked, when is OECD grant money, that's the City Office of Economic and Community Development, when is that OECD grant money going to be available for home buyers for 2020? So the city is now partnering with NeighborWorks to work on the home buyers program. NeighborWorks will have that program ready to go as soon as businesses and services reopen. To track that program, Michelle, go to NWNEPA, so NW for NeighborWorks, NEPA.org, and they'll be updating there on the home buyers program. Let me kick over. This is where I know sorry, it takes me a couple seconds because I'm going through a bunch of different devices and things here. So let me check here. Okay, good there. Sorry, it'll be amazing to be able to be in an office again, huh? Okay. Let's see. All right, some questions, and like we talk about, we're answering these questions live, and so I'm doing my best, and I don't always have the answers, but that's all right. We're all in this together, and that's why we're communicating like this every couple days. So Debbie asks, why is Weston Field safe to open for the homeless, but not safe for the children of the community? So Debbie, I should have said this at the top, and this was in our release that we did to the press over the weekend. The folks that are staying there have to stay there. They're by shelter. It's a 24-hour shelter. They're not leaving. The point of it is, for this time during COVID, that they can't leave the premises. So that's the difference, is having children go in and out, back and forth to their houses and playing with each other. That's could be potentially spreading disease, or not disease, but spreading the virus between families. This is the people that need shelter are going in, and they are staying there for the duration of the crisis. So that's the difference there, Debbie. Marie asks, are there plans for sanitizing businesses and public spaces before reopening? That is absolutely something that we're looking at as we try to start planning for how to reopen. That all of the pieces of reopening are something that we're looking at and planning for, and we've got to figure out what do we need to do, what are the resources, what is the timeline, and how that's going to go. And it's going to be a really tall order, and we'll have to figure out what the governor will order. Are there additional precautions we need to take at the city level? Are there things that we need as a city that are unique to our situation beyond what the governor might mandate? So we are working on that, and we'll keep you all updated. But yeah, we've got to, obviously everything needs to be planned for very, very carefully. And Cindy asks why Governor Wolf is planning to reopen before numbers go down. So I can't speak for the governor. I think that reopen is not the right verbiage. He wants to. I believe he's being optimistic and looking at, can we start to slowly take some of these measures off. I think Governor Wolf. I trust Governor Wolf to do this slowly, methodically, and safely, alongside with Dr. Levine. I think, who's been really tremendous in the precautions that we've taken as a state and in guiding us through that. So we're not going to flip on the light switch and reopen on a dime. I think we will do it carefully. So I appreciate the question, though, because I know that we're doing everything we can at the city level. The governors have a tremendous amount of responsibility in this, and I think that they're trying to work together across to their colleagues. Governor Wolf is working with Governor Cuomo and Governor Cuomo in New York, Governor Murphy in New Jersey, Governor Lamont in Connecticut. I know they're all working together in the same way that I'm working with Mayor Brown in Wilkes-Barre and Mayor Lombardo in Pittston, and been in touch with the mayors of Lancaster and Williamsport and mayors all over the state and the country to try to get the best practices from each other and see what's working and what's not. So that reopening, I think it's not a full reopening. I think we can be sure, and in the same way that we need to look at how do we clean, how do we prepare, what do we do here, we need to make sure that we're only opening by degrees, and to make sure that it's as safe as possible. Okay, so that's one device. It's calm for now. Let's see. Okay. Let's see. Okay, I'm just kind of trying to read through a couple of these. Okay, Glenda asks, Mayor, why would a local hospital send a woman in her 70s back to a nursing home before a test came back? So Glenda, I would need a little bit more information there. I mean, it's not something that I can answer. I will say that type of question and that type of scenario is exactly why we've been asking the Department of Health to be a little bit more public in terms of the communication. I know that they've been in touch with the nursing homes. I know that the nursing homes and the hospitals have weekly calls where it's Department of Health, all the hospitals, and all the nursing homes in our area, which is great. But maybe need that communication to ramp up. Maybe it needs to be more frequent. Maybe some of the players aren't on the call. Maybe it's not working. I don't know. But we have specifically been asking for not just that communication and pushing for it, but for some of that communication to be more, not the content, but the fact of it to be more public, so that we can all understand kind of what's going on and how these decisions are made. So Glenda, it's a good question. And like I said, I can't answer it, but we continue to push the Department of Health to be a little bit more communicative with us in that way. And let's see. Glenda asked about a peak. I shouldn't answer that. I don't think so. I should have asked Dr. Hosier that specifically. I don't think that we've reached a peak. I think we continue to see, unfortunately, that those case numbers are still going up, and those death numbers are unfortunately rising as well. I am really worried, as we've talked about us kind of backsliding, getting tired of all of this. I know we're all tired of this, but if we backslide, if we do reach a quote unquote peak, say next week, we could have another peak again if we don't continue to put these measures into place, and we don't get more testing, we don't get more contact tracing, we don't figure out a way to effectively be, isolating, quarantining the right people, as we try to open up the economy. So we'll continue to have the people like Dr. Hosier on to help us talk through that, and I am grateful for them for keeping us informed. We are, I think, statewide, we've seen a bit of we know we've seen a bit of a flattening. The cases aren't ticking up quite as much, but they do still increase. And I think something also to keep in mind when we think about a peak is that we haven't had enough tests, and so we don't know. I could be sitting here, I could have had it. My mother and I and my husband and baby all live in a small 2-bedroom condominium. We're in very close quarters, and it's possible we could have all had it and not known, right? So we don't know, and so we think about a peak without testing. It's just so hard to know. Let's see. Yeah, I'll say that the 666 is not the greatest number, but I guess we can just kind of have I don't know. What can we do? We try. If we don't laugh, we'll cry, right? So we gotta keep on. Let's see. Uh, wait, let me check and see if there's other questions here. Okay. So, John, the governor did extend the stay-at-home order until May 8th. Like I said a couple of minutes ago, we extended last week until April 30th. I will certainly be extending till May 8th, along with the governor. I'm going to give it a few more days. It takes just paperwork. I have to go in and sign it and things like that. Right now, we're covered under that period. I'm going to give it a few days to see if the governor extends it, again to May 15th or something before we officially go to May 8th. But we will certainly follow the governor. I'm absolutely not going to open, quote unquote, start opening up Scranton before the governor does. In fact, we're more on the other side of it. I think given our population density, given that we have so many older adults in Lackawanna County, in Scranton, we have so many nursing homes. I don't want to be lifting restrictions prematurely. So we definitely will follow at least the governor's lead on that. Let's see. Chris, parking is my favorite topic. I actually can't wait to get back to the days where parking is something that we're talking about at the top of the hour, instead of deaths. So considering how hard downtown businesses got hit, any way the parking situation can be fixed. I'm friends with a lot of those business owners. I've seen what they went through before this. So Chris, we have been in touch with, or had been before the crisis, was already working pretty closely with NDRC, the people who manage the parking, to figure out what we can do for small businesses. The way that the structure that we inherited is something that I don't believe is tenable for our small businesses and the strength of our downtown. The parking structure just doesn't make sense. So I agree, it's something that we will work on and try to figure out how we can make it better. And sometimes with crisis comes opportunity, and I think, Chris, you're right that this economic situation that's coming out of this crisis is something that we hopefully can use to get that fixed. And just a reminder out there, downtown parking is not something that the city regulates. We certainly have a voice and have a close contact with NDRC, and I think there are good people who they want places to thrive. They have a stake in that, and this will certainly change the conversation. So I really appreciate that question, and we need to make sure that we're helping our small businesses, and that's where we're looking at some solutions for how we might be able to help them over the course of the next days and weeks and months. I know that the PPP, the program from the federal government, has come through for some people in the area, and that's tremendous, but it's not enough. And they're still working on an extension of that, another pool of money. There's a tension right now between having it go for businesses and then trying to get state and local funding into that bill. It looks like that is not, I don't think that that's going to happen in this particular bill, but I'm certainly pushing. I've been in touch with, Senator Casey, Senator Toomey, Representative Cartwright, to pitch that, you really need that direct funding to a city like Scranton to be able to recover and help figure out how we're gonna really sustain all of city government's services, as we will see a drop in revenue both in 2020 and in 2021. With that, I've been talking about this from the very, very beginning of this, that the most important things for me as a city manager, the mayor, police, fire, public works, I have to do everything I can to make sure that those three departments are fully funded. Sorry, four, including enforcement. That's hugely important too. Obviously, we have to we have to collect taxes. We have to answer your questions. But I can communicate with you with Zoom and phone and Facebook, and this doesn't really cost us anything, which is tremendous. But I have to be able to fund everything in those four departments. So it's really tough from a budgetary standpoint. We still don't know what the fallout's going to be here. We're still looking at what's that balance between reprieve for taxpayers in a time when people are furloughed, laid off, not able to even pay their bills, and making sure that the city is properly funded. So we're still looking at that. A small thing is looking at the refuse bill. Those aren't out yet. We usually get a question about the refuse bill. Maybe I missed it. They're not out yet because I am making sure that what we're doing with the refuse bill is something that we clear through city council, and something that when we get you that bill, it's the right information with the right deadlines and the right penalty periods. I'm hoping and pretty confident we'll be able to extend the period so that you don't face penalties until the fall. I don't want to be charging penalties in this next set of months while everybody's struggling. So that's why the bill is taking so long, and we're trying to give a reprieve there. So that's the type of thing we're dealing with on a budgetary from a budgetary front, is how do you do right? How do you give taxpayers relief, but also provide taxpayers, residents, with the services they need? It's almost like a case study problem. You can't even, sometimes I look at it and I think this is unbelievable that I'm not just reading this in some sort of fictitious way in school, that this problem is so deep you almost think that it's not really happening, but it is, and we're working really hard. That's a huge piece of what I talk to other mayors about, is the budget pieces. This weekend I was on a really helpful call with some other mayors of similarly sized cities in our state. How are they looking at the budget? How are they managing? What do their furloughs look like? I know there's a city that's announcing some furloughs today or in the coming days. Similar to what we did from the beginning of this crisis, and it's devastating. It's awful to have to do it. What's good is that if there is a silver lining, is that the extra unemployment help should be boosting the incomes for a lot of furloughed workers around the state and the country. So that's one small piece of good news in an otherwise really tough situation. Let's see, and I got a question from Christina. Do you know when schools and daycares will open again? I don't know the answer, Christina. Those are kind of two different questions, right? So I think daycares, which are year round, there's going to have to be more pressure on the daycare system to see if they can open as people go back to work over the late spring and summer. Schools, aren't going to open until August, and I know that Department of Education is working on that. The school district is working hard to try to do some celebrating for the class of 2020. We've talked about that, trying to figure that out. I do feel bad for those kids. It's tough to not get to celebrate your senior year in the way that you thought you would. But Christina, we'll keep an eye out on the daycare piece. I personally am curious about the daycare piece myself, and we'll continue to keep you posted as well as we can. Let's see. Okay. All right. Oh, that's what I want to talk about. So, Patricia, you said cars need to slow down on Greenridge Street. We'll make a note about that. Our police force continues to do a really great job in this time of trying to keep order around. But speaking of that, I've gotten a lot of complaints about littering in our parks. Um, it Please don't litter. I don't understand littering. Just ever since I was a little kid, I don't get it. Why would you ever litter and have somebody else pick up your garbage for you? It's beyond me. We've had a real problem with it, though. I was just on with our Parks and Rec director today, and he was in touch this morning with Pennsylvania American Water at Lake Scranton. That littering continues to be a problem there. Please be a good neighbor, be a good citizen, pick up your own trash. Not only is it the right thing to do and something you learned when you were 3 years old, but it's not in this time where we're trying not to touch things other people touched. Why would you increase the work and the susceptibility to the virus for people on our Parks and Rec teams, our sanitation teams? Those guys are out every single day picking up garbage. They are, I mean, it's incredible what they're doing every day. I know their families, they know that they're out there in the world at a time when it's really scary. So please don't litter. We're gonna help get some more signage up, and I guess we'll need to do some PSAs around littering. This crisis is showing us that there's some things like budgeting and financing a city that we have to work on over here, and then gotta fix littering over here. So please make my job easier. Don't make me nag you about littering. And in terms of the parks and Lake Scranton, the parks are open so that we can all take a mental and physical health break, but it's not calming if we're walking too closely together, if we're not following social distancing. If you're at Lake Scranton and your family of four is all the way across the path, don't take if you have two drivers in the family, maybe two of you go in the morning, two of you go later in the afternoon, something, break it up so that you're not in a situation where you're taking up the path. That just kind of ruins it for everyone. And we gotta really try to understand how our actions impact the others around us. It's really important. So let's see. If Michelle's asking if we can clean up areas, will the collected garbage get cleaned up? I'm not sure, Michelle. I'm not sure what you mean. Why don't you and I have been in touch before. Just let me know specifically what you mean, and I'll circle back with you. Let's see. So, okay, Fran, if you have a specific place that you think is running some sort of social activity, this one sounds like it's in North Scranton. Email that to Scranton 311 at scrantonpa.gov, or call 348-4101, and we will go check it out. Same goes for all of these things. I know there was Kevin from Friday was flagging a religious, or excuse me, a faith-based organization that was still having services. And Kevin, I really appreciate you raising that, and we've now spoken with the leader there. As we've talked about, we cannot order a faith-based institution to not have services, but we can strongly, strongly urge that they practice social distancing and remote methods of worship. And I do think not only do those calls that we make help, but we only know about it if you out in the community let us know. So Fran, please get the details to us via phone or email, and we'll go check that out. Let's see. And Frederick is talking about gambling machines. I'm not sure about this gambling machine issue. Any more information you have on it, please do let us know. But that whole issue, right, speaks to people not doing what they're supposed to be doing for each other in social distancing and not following. I hate to say following the rules because it sounds like I'm a school teacher. That's not. This isn't about trying to keep you in line and teach you how to behave. This isn't what this is. As we've talked about, it's about staying home to save lives. It's about staying home so that you're not endangering the life of your family member. You're not endangering the family member of another person. We have so many people out on the front lines, our healthcare workers especially, and not just the healthcare workers, the doctors and nurses, but all of the administrative experts and professionals who are at those hospitals and healthcare facilities, all the cafeteria workers at those facilities, all of the people who help clean up, the janitors, custodians. I mean, my goodness, there's everyone that is at a healthcare facility, a hospital, is really putting their lives on the line for us every day. So if we're going out and playing some like slot machine at some neighborhood store, I mean, come on, that's not the spirit of this, because we really are doing this for a reason. It's not just an exercise for fun. It's just something we have to do for each other. So please continue to do that. Please don't litter. Let's be good neighbors and not litter. I deeply appreciate all of you for tuning in and continuing to have this conversation with us. The phone number is 348-4101. The email scranton311@scrantonpa.gov. Continue to please send us your questions and your concerns. We'll deal with them as best as we can. Answers we don't have for you, we'll try to get to you the next round of this and try to point you in the right direction. Like I have been saying, I don't have all the answers. I'm not going to pretend to have all the answers, and that's why this is so important. If we continue to communicate, we're going to be able to improve the way that we can help each other, and the way that I can help the city improve the quality of life for every one of you. So thank you so much. We'll be back Friday at noon. And everyone, be well, stay safe. Know that this is going to be okay. It really, really is. I think we're going to come out stronger out of this. I even think that there's a possibility that our economy will eventually be stronger from this. I think businesses and will have to be more efficient and in a way that leads us to be able to maybe have a more nimble economy and figure out what's the best way that we can help our communities. What's the best way? What's our best talent? What should we be doing for a career? I think there's going to be some movement that's really positive in that way. And we have that virtual job fair on our website. So if you're out of work and looking for work, there's that virtual job fair at scrantonpa.gov. There's lots of opportunities out there. And I think that as eventually we're able to reopen the economy, I think we're going to see some really positive things. So keep your spirits up. Call your loved ones that live in your household. Call your grandma. I need to do that. It's been a couple days. And be well. Thank you.
Goodbye.